she could barely look in the mirror after having a lip job that went horribly wrong.
Laura was offered a cheap filler treatment to plump up her lips.
Over the last few years, there have been headlines popping up shining a spotlight on the dangerous side effects of non-surgical aesthetic treatments. Some of these complications have negatively affected the lives of individuals. My name is Dr Haroon, and I am a cosmetic doctor who specialises in non-surgical aesthetic treatments, and I'd like to delve into the topic of safety within the aesthetics industry. We'll discuss why people may think that these treatments are more dangerous than they truly are, what dangers should you be aware of, what is the true safety profile of these treatments, and how you can have these treatments and remain safe. Let's get into it. The first thing that I'd like to mention is that non-surgical cosmetic procedures are undoubtedly medical procedures. They are not beauty treatments. These medical procedures should only be carried out by qualified medical practitioners to minimize any risk. With that being said, medical procedures are not risk-free and things can go wrong. Generally speaking, injectable treatments are safe when carried out sensibly by medical practitioners. The chance of anything bad happening dramatically increases when the person injecting is not a qualified medical practitioner. Now, unfortunately, in the UK, there is no regulation when determining who can and cannot administer these treatments. Literally anyone can carry out these treatments in the UK because there is no law that is stopping one person from injecting another person's face. That means the next time I go and see my accountant, they can administer my Botox injections with no prior training and no understanding of anatomy or injection technique. And in the eyes of the law, this is okay. Now, obviously, this is not okay. And just because the law says that it's okay, it does not mean that it's safe. There has been a lot of talk of regulation coming into place regarding this. However, it is slow progress, and unfortunately, clients have to educate themselves and keep themselves safe. The large majority of complications are at the hands of non-medical injectors, and depending on what year you're looking at, 90 to 95% of all aesthetic related complications that ended up in the accident and emergency department were as a result of non-medical practitioners carrying out the treatment. If there is one simple thing that you can do to keep safe, ensure that a medical practitioner carries out these non-surgical aesthetic procedures. One last main reason that some people might over-exaggerate the risks involved in these non-surgical aesthetic treatments is the coverage of them on media outlets. I'm sure most of you know it, but the media has a reputation for sharing mostly negative news. Without going into too much detail of what their business model is, negative news generally gets more eyeballs than good news. Hence, whenever a complication occurs or a treatment is botched, it's more likely to be broadcasted all over the media outlets, which can give the impression that this is happening a lot more frequently than it truly is. When was the last time you saw a successful, maybe even life-changing aesthetic treatment be broadcasted on the media? When in reality, there are hundreds, if not thousands, of aesthetic treatments that are carried out every single day in the UK. The media outlets obviously have a job to do, but my advice would be to find out what is the true risks of these procedures and how frequently they occur from trusted sources, rather than simply relying on what you see in the news. As mentioned at the start, these are medical procedures, and with every medical procedure, there are some risks involved, and that's what we'll be discussing briefly now. With any injectable procedure, there is a chance of swelling, bleeding, and bruising. A small amount of swelling is almost guaranteed due to the nature of these treatments. Anytime you pierce the skin with a needle, there will almost certainly be some element of swelling. This is a natural reaction from your body. The swelling is usually minimal and is usually only in the area that's been treated. There is usually some swelling on the day, and the swelling generally peaks around 24 hours after the procedure, and it will then start to settle. The swelling will be more noticeable to you and maybe your friends or family, but will usually not be noticeable to strangers or people that you've just met. Bruising can also occur anytime you pierce the skin with a needle. Small bruises that occur just where the needle enters are fairly common, and larger bruises that span over 1 centimeter are quite rare, although they can happen even with the most experienced injectors. It's important to mention that swelling and bruising is not dangerous. It's an expected side effect of the treatment and generally resolves within the first few days following treatment. Also, anytime that the skin is pierced, there is a risk of an infection. However, this side effect is extremely rare, especially when good infection control measures are taken, such as using sterile needles, wearing gloves, and cleaning the area of treatment thoroughly before and after. You're not going to be surprised when I say this, but the easiest way to stay safe with these treatments is to go to a medical practitioner and to have them carry out these medical procedures. It sounds simple, but when non-medical injections are charging a fraction of the cost for what seems to be the same treatment, it can be quite tempting. You must ask yourself though, how can they be so cheap? What is the quality of the product they are using? Are they paying for medical insurance? How much time and money have they spent on formal training? Generally speaking, medical practitioners have spent thousands of pounds on training to ensure that they are competent and safe to carry out these procedures. They've also spent thousands of hours learning anatomy and understanding how to deal with complications, and ensuring the techniques that they carry out are effective, but more importantly, safe. Every single medical practitioner would have studied in university for 3 to 5 years. During this time, you're taught about anatomy, how complications occur, how you deal with complications, and how you can carry out procedures effectively and safely. This gives a significantly higher level of safety when compared to non-medical practitioners, and the rates of complications are significantly lower. Now, it's not to say that complications don't happen with medical practitioners either. They still can happen. However, medical practitioners are taught to recognize and handle complications more effectively if they were to arise. There are some good non-medical injectors out there that can produce good cosmetic results. However, if a complication were to arise, they would not be as efficient at recognizing and dealing with medical complications. They simply don't have the 3 to 5 years of training that medical practitioners have in this domain. So, if you want to maximize your level of safety, find someone who is a medical practitioner and have them carry out your medical aesthetic treatments. I hope you found this video helpful, and I hope I haven't scared you too much. It's important to remember that these are medical treatments, and you should seek to have these treatments carried out by a qualified medical practitioner. Generally speaking, these treatments are extremely safe if carried out sensibly by medical practitioners. If you have any questions regarding these treatments or any other treatments that we offer, please get into touch. Thank you guys, bye now.